we kind of look at this kind of like we're all on the same team. We're all trying to do the same thing. We're trying to have harm reduction. And if people come into your clinic and you're kind of browbeating them and you're telling them shame, you shouldn't, you should know better. You gotta see where people are. People are at a point where they really want to change. They come through your door, they already feel bad. They already feel embarrassed. So they're already in withdrawal. Life is already bad enough for them. If you can meet them where they're at and say, hey, I hear you. I'm not going to judge you. I'm not your mother. I want you to have a good outcome. I want you to be able to come back, because if you come back, I can treat them. And I tell patients all the time, there's a book called The Power of Now. Right now, I've got that patient in the seat, and right now I can do something. If I shame them and they don't come back, I'll never be able to help them. So, and this isn't like, you're trying to get somebody to stop smoking. Well, that could take 20, 30, 40 years before they have a real impact with that. This is fentanyl on the street. They could die today.
Right.
So, you've got to deal with what you got. And sometimes people come in and they try to pull a fast one. You just have to know that they're not clear-headed. You have to get them to a point where they're clear-headed. And once they get clear-headed, probably most everyone will say, oh gosh, at the time when I came in, I couldn't really hear everything that you were trying to tell me because it's just too much, because I'm actively having withdrawals. I can't hear everything you're saying. So I try to get them back. I try to get them on an effective dose. Once they come back, get an effective dose, they get 5, 7, 10 days clean. Now we're having a different conversation. But sometimes it takes a while for people to get there. And you just have to be aware that fentanyl has kind of really changed everything, and people are dying.
Yeah, and it's so prevalent. Like you said earlier, it's in everything. So that then ups the ante a bit. So you are using naloxone in your practice. Can you guys talk a little bit about, just educate our team a little bit on how it works and then how you're using it and maybe what you've seen? Are you seeing people use it? Do they come back to the clinic and say, I used it, or I used it on a friend and I need another prescription? Just talk a little bit about how it works, how it's used in your clinic, and anything you've seen.
Well, I think it comes down to sort of basic science. Naloxone is an opiate blocker. It has such a strong affinity to that mu receptor where opiates like fentanyl and heroin attach to. It sort of pushes it out of that receptor. And that's sort of the mechanism of action to reverse an overdose. So if somebody uses fentanyl and they're overdosing and their respiratory drive goes down and everything, and they stop breathing, they're given naloxone, which immediately makes an impact and reverses that effect. It's essentially, like I said, pushes that opiate molecule out of that receptor. Yep. It is certainly life-saving. I think that Rio can also attest that for me, many of my patients, they've had that experience, or they've had to utilize naloxone for somebody to save their life. I had a patient that was using fentanyl, and he said to me that they had to use, naloxone like 4 or 5 times to sort of bring him back, from the precipice of his own death. And so it makes a huge impact. So essentially that's the mechanism of action.
That was a great explanation, Randall.
Yeah.
Great explanation.
But typically what I see are stories of people coming in saying either they were Narcan, and I can think of yesterday, I had a new patient who came in and his best friend died over the weekend on the day before. He said it was my best friend for 30 years and they were using in the house, and he had 2 Narcans and he used them both, and his friend still died right there in front of him. And so he came in the clinic the next day and he was like, I have to change my life. I've heard about this Equinox Clinic that you guys hear about people. And he came in. So we'll see how he does. We'll see what happens. But that is a really common thing. People coming to us after getting Narcan, they don't want to go back.